Hello, everyone. My name is James Callahan from the Michael Garron Hospital IPAC Hub. I want to thank you for joining us today and welcome you to another LTC CIP group lecture. Today, we have Dechen Chhakpa from Scarborough Health Network presenting our fifth lecture in our series, Environment of Care. Dechen is a nurse by background and has worked in IPAC for 6 years. She is certified in infection control. Dechen is currently pursuing her master's in health studies at Athabasca University in Alberta. Dechen is currently an infection control practitioner at Scarborough Health Network, and she provides her expertise to long-term care homes and retirement homes in the surrounding community. And with that, I'm pleased to hand over the presentation to Dechen.
Thank you so much, James. Okay, so I think we're going to get started here. Let me just... Okay. Sorry, I'm just trying to retrieve my notes here that I just had a few seconds ago, actually. Sorry. Okay, so I'm going to start sharing now. Okay, and I think you can see my screen. If you can confirm, James.
Yep, that's right.
Excellent. Thank you. Hello, everyone. Welcome to the sixth session of the LTC CIP Prep Study Group. And today, with pleasure, I will be presenting on the topic of environment of care. So here is the agenda for today's session. The content outlined here is from CBIC, which creates the exam. And my goal here is to cover these items so it can help you prepare and study and succeed in passing your exam. The topic weighs 12% of the exam, which translates to 18 questions out of the 150 questions. So let's begin and discuss one of the most important components of the environment of care, which is the HVAC system. HVAC stands for heating, ventilation, and air conditioning. So how does the HVAC system work? The HVAC works by supplying air, which is conditioned by passing through filters, and it's heated, cooled, and humidified, dehumidified through the HVAC apparatus before distribution. And the air that most systems use is outdoor air because the microbial contamination is much diluted and has greater gas and odor control. It is essential that we understand the important role the HVAC system plays in any healthcare settings because there are many microorganisms that are present in our environment, and some more than others can have a huge impact on the health and well-being of our residents. The two main organisms of concerns are Aspergillus and Legionella. Aspergillus is a fungi that is found in soil, water, decaying vegetation, and building materials. And the mortality rate is between 25 to 59% among transplant cases. Aspergillus species can be introduced to healthcare settings through constructions and renovation activities. Whereas Legionella is a bacteria that's found in the water and also found in soil, and the mortality rate is 25% for hospitalized cases. We'll talk more about these two organisms in more details later on in the presentation. So this is a diagram that shows how the HVAC system works. On the top left, you see that the outdoor air is sucked in into the ducts through a vent, which then passes through filters to dehumidify the air, and then passes through filters and fans to humidify the air, and then finally supply the air to the home's interior. Depending on the air exchanges within the home, the air can be removed to the outside through the return air grill and be replaced by fresh air through the air supply, and the cycle continues. So here are some of the main components of the ventilation system. As mentioned earlier, most systems use outdoor or fresh air as their main air source. However, some systems use a mixed percentage of the exhaust air as their air source. Then we have the air exchanges, which is the number of times that the air volume of a given space is replaced in 1 hour and includes sufficient changes of outside air to dilute microbial contamination and gases. It is very important to note that the airborne room should have at least 12 air changes per hour. Although I understand that most long-term care homes do not have airborne room or negative pressure room. Air pressure is the pressure relationships with the respect to the surrounding area or corridor. So depending on the type of rooms, air pressure can be positive, negative, or neutral. Positive pressure is when there is excess air supply in the room. Positive air pressure is used to keep microbial contamination out of the room, and therefore it's used for immunocompromised patients, such as those undergoing bone marrow transplant, and hence why positive air is used in OR and special procedure rooms. Other areas where you can see positive air pressure is clean supply room, clean linen room, pharmacy, medication room, and the sterile storage area. Whereas negative pressure is when air is drawn into the room. So example of airborne, example of negative pressure, air would be in airborne rooms, in the toilet, soiled room, ER waiting rooms, and sterilizing room. Negative air pressure is used as an isolation measure to keep microbes from escaping the room and is used for patients infected with organisms transmitted by airborne route, for example, TB, measles, and varicella. And lastly, neutral pressure is when the air pressure is neither positive nor negative. And these can be in areas such as the food preparation center, laboratory, recovery rooms, the patient corridors, and the general service area. So as I already mentioned, HVAC systems uses pre-filters before fans to remove gross particulate matter. And HEPA filters, or high efficiency particulate air filter, is defined as the highest quality of air filtration that can remove at least 99.97% of dust, pollen, mold, bacteria, and any airborne particles with a size of at least 0.3 microns or more. Most airborne infectious organisms fall into the range of 0.3 to 5.0 microns. So during the pandemic, COVID pandemic, portable air cleaners equipped with HEPA filters or a filter with the minimum efficiency rating value or MERV of equal to 13 or over 13 were suggested to have reduced SARS-CoV aerosol exposure over time, which helped to limit the risk of aerosol transmission. The MERV uses a scale of 1 to 16. So a MERV 13 is equal to 80% efficiency, and MERV 16 is equivalent to 95% or more. So when you don't have a HEPA air filter, MERV 16, go with the higher number of MERV if possible. It is also really important to frequently monitor your environment to mitigate any associated risk. It is important to do on-site visits and ensure that construction or maintenance procedures are following good IPAC standards. Likewise, doing any sort of construction or any kind of work with contractors, ensure that the contracts certify to the owner's satisfaction, owner meaning the facility which you're going to be part of, whether it's ensuring that all HVAC specifications have been met or include specification or criteria that were decided to be included upon the contract being signed. Although sampling of the environment and culturing in disease outbreaks have been well substantiated, they're not recommended as a routine measure. So this leads to our very first question. Which statement is true? Air supply, A, air supply generally should be near the center of the work area. B, return air exhaust should be near the floor level. C, fresh air intake should be located at least 25 feet from exhaust outlets of ventilation system. D, the bottom of outdoor air intake should be as high as practical, at least 6 feet above ground level, or if above the roof, 3 feet above the roof level. Or is it E, all of the above? So take a, if you want to pause here and just compare your answers with the correct answer, this is the time to do so. If not, we're going to move on to the next slide, which will have the answer. So the correct answer is E, all of the above. Okay, so all these statements are in fact true, and that's part of the guidelines and recommendations. So next up, we have water management. So the impact of water-related contamination on health in any setting is far-reaching, and consideration of water issues is an essential component of the infection control risk assessment, or ICRA in short. However, since water is delivered by the community public water supplier, the responsibility for water management is shared by the healthcare facility within an outside entity. Once water enters the facility's distribution infrastructure, it then becomes the responsibility of the facility. However, both entities, the public water supplier as well as the facility, must play an important role in infection prevention. So before we discuss water management, let's first read up on some of the basic terminologies to get a better understanding. So I'll pause here. Please do read these definitions. You need to know all this so you can be able to understand when we're using these terminologies. So as mentioned earlier, Legionella is a gram-negative bacteria that's commonly found in the water. Because the organism is chlorine tolerant, it survives the water treatment processes and passes into the drinking water system in small numbers. They are ubiquitous and found in about 20 to 40% of freshwater environments. Legionella tends to favor warm temperature for growth, and according to ASHRAE, ASHRAE, which is the American Society of Heating, Refrigerating, and Air Conditioning Engineers. They provide lots of guidelines and recommendations, and they report that water temperatures between 25 to 42.2 degrees Celsius supports the growth of Legionella, whereas CDC reports 25 to 45 degrees Celsius. It's really important you know the American temperature reading as well, which is the Fahrenheit. So please note the degree Celsius as well as the Fahrenheit. So wherever Legionella is present, they can also be protected within biofilms. And biofilms comprises of cell embedded in the matrix of polymers and abiotic particles. They're also described as a growth of variety of microorganisms that stick on wet surfaces and tend to produce a film or a slimy coating. Biofilms can be very difficult to prevent and eradicate, and therefore can cause problems, especially among immunocompromised patients like transplant patients. Unfortunately, it is inevitable that biofilms will form in most water systems. In healthcare environment, biofilms may be found in the potable water supply piping. Potable water meaning water that is suitable for drinking. They can also be found in hot water tanks, air conditioning, cooling towers, or in sinks, sink traps, aerators, or shower heads. So there are many Legionella species, but the most concerning species is Legionella pneumophila that causes Legionnaire's disease, which is a severe form of bacterial pneumonia. CDC reports that 96% of reported cases were hospitalized in 2015. Unfortunately, this disease is also dramatically increasing, and approximately 1 in 10 individuals with Legionnaire's disease will die from the infection. It is also reported that solid organ transplant recipients appear to be the highest risk for Legionnaire's disease. Other risk factors also include corticosteroid usage and renal failure. In late 2008, a Legionella outbreak in neonatal unit in a private hospital in Cyprus, Europe, was declared, where 11 cases tested positive, and the mortality rate was reported to be 27%. The source of Legionella bacteria was the water system of the neonatal unit. So that is just one of the implications of Legionnaire's outbreak. Similarly, water-related outbreaks have been documented to arise from a variety of sources, including splashes from sink drains containing contaminated biofilms, aerosols from shower heads, contaminated potable water used with resident care equipment, or directly with the residents themselves. So given the dangers of waterborne pathogens, what can be done? Here are some of the preventative measures we can take to mitigate potential risk, such as maintenance of hot water tanks, maintaining hot water temperature at 60 degrees Celsius or 140 degrees Fahrenheit will minimize the growth of Legionella. Removal of aerators and dead leg pipe or unused pipes, and cleaning of the shower heads. Installing stop valves for each fixture is in the main water lines will allow a portion of water system to be repaired without disrupting the remainder of the system. Installing vacuum breakers or backflow preventers on faucets will prevent potential contaminated water from flowing back into the facility's water supply and potentially contaminating it. Avoiding installing drainage piping in ceilings or exposed in sensitive areas, as it may increase the risk of damage to ceiling and surrounding structures. And as mentioned earlier, ASHRAE, the American Society of Heating, they recommend to avoid water temperatures supporting the growth of Legionella, which is between 25 to 42.2 degrees, and therefore the cold water to be stored below 20 degrees Celsius, and hot water to be stored above 60 degrees Celsius. So the other preventative maintenance that we can also implement is cleaning and disinfection of cooling towers and water fountains, biocides, applying them at labeled dosages to control the growth of bacteria, algae, and protozoas, and removal or prevention of sediments accumulation as well to reduce the microbial growth, and plumbing that includes self-draining shower lines, anti-scald valves, and pipe installation may also reduce contamination risk. So now here we are in our question 2 part. What is the range of water temperature for prevention of growth of Legionella bacteria? So I think I mentioned in a couple of slides already about the temperature. This is a question, an answer that you have to memorize, right? So understanding the growth temperature for the Legionella is very important for you to answer this question. So I'm going to pause here for those who would like to compare your answer to the correct answer before I move on to the next slide with the answer. So the correct answer is A. ASHRAE recommends the cold water to be stored at 20 degrees Celsius and the hot water above 60 degrees Celsius. And because the other options are nowhere close to that, and that would be the most appropriate answer. Okay. So there are many reports of poor sink designs that have been associated with outbreaks in many healthcare facilities. Faucet aerators on sinks can enhance the growth of waterborne organisms, so avoid it if possible. However, if you already do have aerators in your faucets, then regularly cleaning can avoid its potential risk. Sinks should also be accessible, but positioned so as to prevent splashing on nearby equipment and supplies. Outbreak related to sinks have shown that contaminated water was splashed onto supplies that were stored 1 meter away from the sink. If storage cannot be avoidable next to the sink, items that are stored should be non-porous to resist fungal growth, and areas beneath sinks should not be used for storage to prevent contamination to stored items from potential leaks that may happen. As for water artifacts, though decorative water fountains and water walls can be very therapeutic for our clients and families, they are evidence that clearly show that they may aerosolize waterborne pathogens and present an infection risk. Stagnation of water and underwater lighting can provide an ideal environment for Legionella to grow. If water fountains are present, they should be systematically disinfected and routine preventative maintenance should be in place. Though uncommon, contaminated ice and ice machines may also be implicated as sources of infection. Therefore, maintenance for ice machines should be completed on a regular basis, depending on the type of task, such as cleaning ice storage chest on a more frequently basis, and disconnecting and assembling the machine, cleaning thoroughly, and checking for evidence of leaks can be done on a monthly or quarterly basis. Although CDC guidelines exist, manufacturers' instructions should be followed, and EPA-approved disinfectants suitable for the equipment should be used as a general first step. As for whirlpools, contamination of whirlpool and baths have been reported, and it may involve plumbing drains and agitators. And among many other pathogens, Pseudomonas aeruginosa has been associated with bathtubs and whirlpools. Therefore, drain designs that seal at the top of the opening can greatly reduce the risk of contamination, as well as cleaning and disinfection of tubs and jets using specific spa cleaning products, as well as following proper draining and flushing sequences are very important to follow. Our next topic is waste infestation in animals. So before we begin our discussion on waste management, let's address some of the misconceptions surrounding it. The first misconception is that exposure to a pathogen in waste will likely result in infection. That is not true, okay? The second misconception is that hospital waste are more heavily contaminated than household waste. Again, not true. In fact, multiple studies have shown that although hospital waste can have a greater variety of organisms than residential waste, household waste are actually more heavily contaminated. And the last misconception is that most garbage, soiled bed linens, and diapers require special handling requirements. In most cases, they actually don't require special handling requirements. So this is a chain of transmission in waste, very similar to the chain of transmission that we are all aware of. So in order for waste to transmit infectious agent and cause infection, all of the following specific requirements must exist, okay? So all these factors must exist. So, and they are infectious dose must be high enough, the host must be susceptible, a pathogen must actually be present, the pathogen must be virulent, and a portal of entry into the host must be accessible. So by following good IPAC practices, we can easily break that chain of transmission in waste. And they are hand hygiene, appropriate PPE, and cleaning and disinfection to prevent the portal of entry into our host. So in every healthcare setting, there will be waste. And what should the waste management plan look like? An efficient waste management plan includes definition of what is considered infectious and non-infectious waste, and address every step from acquiring materials to discarding, collecting, containing, handling, storing, transporting, treating, and ultimately disposal of the waste products. These procedures and protocols should be written and follow the regulatory, advisory, and licensing agencies. And overall, the key to a successful waste management plan is a collaborative effort that includes the infection preventionist, as they will be able to provide the IPAC lens into any case scenarios and prevent any potential transmission. So the term regulated waste is interchangeable to biomedical waste or medical waste. And OHSA stands for Occupational Safety and Health Administration. Organizations may choose to rely on the OSHA definition of what a regulated waste is. And regulated waste are infectious waste that are liquid or semi-liquid, blood or other potentially infectious materials, contaminated items that would release blood or other potential infectious materials in a liquid or semi-liquid state if compressed, or items that are caked with dried blood or other potentially infectious materials and are capable of releasing these materials during handling, or contaminated sharps, pathological microbiological waste containing blood or other potentially infectious materials. So that's a definition of regulated waste, also known as biomedical or medical waste. So here are some key points to note. According to OSHA regulation, biomedical or regulated waste should use the red coloring code or the universal biohazard symbol as pictured above. Sharps containers must be impervious, rigid, puncture resistant, leak proof on the sides and bottom, and they should be closable. A sharp container should be installed in the laundry area in case sharps accidentally end up in soiled linen. When it comes to disposing human waste in bedpans, system design should provide for emptying bedpans without leaving the residence room or for minimal travel distance to soiled utility rooms for flushing or cleaning. Plastic bags are appropriate for bulk solid or semi-solid infectious waste or containing residual liquids, as long as these bags are impervious and tear resistant. Suction canister pictured here must be tightly closed and placed in plastic bags. Bags may then need to be placed in a secondary container, such as a cardboard box, to preserve the integrity and the packaging rather during transport and storage. And modern day detergents are actually much more effective in removing soil and reducing the presence of microbes. Laundry detergent used within homes are not required to have stated antimicrobial claims, and all resident clothing must be marked with the resident's name to ensure that the clothing is returned to the correct resident. So here's a flow chart of how minimization and segregation may be implemented within a facility. I'm sure you're all aware, inappropriate waste management can incur a lot of cost to facilities, and therefore it is so important to ensure waste are segregated appropriately and minimized as much as possible. And therefore understanding what is truly a regulated waste versus a general waste is very crucial component to this because incineration costs can be quite expensive. So infestation management, as cringing as it sounds, unfortunately, we do see lice and bed bugs infestation in long-term care homes from time to time. Lice typically spreads through fomites such as hairbrushes, caps, scarves, and coats. And controlling lice infestation is most easily achieved by the use of heat, such as washing and drying items at high temperature. However, when heating application is not possible, freezing items or sealing them in plastic bags for a length of time may work as well. As for bed bugs, they feed on blood, usually at night, and the most effective way to eradicate bed bugs is through the use of high heat. Freezing is also another option, but it is less successful. And to note, a fun fact, adult bed bugs can survive as long as 1 year without a meal. So in any cases of parasitic infestation, whether it's lice, bed bugs, or any new bugs that, the world has now found, the IP should be working with the pest control professionals and the larger team to control and prevent potential spread. Pets and animals. Pets and companion animals can greatly improve residents' quality of life in a home setting. However, they can also transmit pathogens such as MRSA and C. difficile. A long-term care homes facilities animal program policies and procedure must include measures that reduce risk of transmitting organisms. Animals should be clean, fully immunized, and well-mannered, and with no signs of or symptoms of infection. The volunteer department or the reception will have the most frequent contact with visiting animals, and they should help maintain vaccine documentation. Each state and municipality may have different health requirements for animals, including the processes for recording animal bites. So you should be familiar with your own state's or wherever you are policy when dealing with pets and animals in your home setting. Question 3. Okay, so which of the following recommendations should be made to reduce the risk of infection from sinks in patient care areas? A, sink basins should be deep enough to prevent splashing of water onto nearby patient care items. Or B, sink faucets should be located such that flow of water hits the drain directly. Or C, sinks should be placed within 2 feet of the point of care to encourage frequent hand hygiene. Or D, aerators should be installed on faucets to minimize the amount of splash in the sink. Or lastly, E, sinks should have enough counter space to store supplies nearby and underneath the sink. So pause it if you like to compare your answer to the correct answer. And if you've already answered, I'm going to move to the next slide for the answer. So the correct answer is A. So sinks should be deep enough to prevent splashing of water onto nearby care items. That is the only appropriate answer. The rest are all incorrect, and that is not part of the guidelines. So in December of 2004, a Toronto hospital declared an outbreak of multi-strain of Pseudomonas aeruginosa. And sadly, 36 patients got infected. And of that 36 patients, 17 died within 3 months. When an investigation followed, and it was found that the source of the Pseudomonas outbreak was the hand hygiene sink drains. There has been multiple studies done, and research shows that sinks with shallow bowls can splash contaminated water onto providers' clothing and any patient care items as well within the radius of several feet away. And faucets with aerators contained more microbes than those without aerators. In addition, it was also found that the use of splash guards or sink barriers could also help prevent contamination to patient care items or where the sink was really close to the supplies. Question 4. A resident has been detected to have hair lice. What is the most appropriate action? A, prophylactically treat residents' close contact, including staff who provided care. B, use an insecticidal spray in the room after the resident has been discharged. C, launder residents' clothing and bedding on high temperatures and supply visitors and staff with a disposable scrub cap. Or D, initiate contact precaution until 24 hours after appropriate treatment has been initiated, including pediculicide, laundering clothing, and bedding on high temperature. So you can pause here for a bit before I move on to the next slide with the correct answer. And D is the correct, most appropriate action when you detect a resident to have lice. Okay. Question 5. A nurse has contaminated his scrub top by a large blood spill that has penetrated the fabric. Choose his best option to follow. A. He should be excused from work and be sent home to take a shower. B. He should remove the top by carefully pulling it over his head and launder it with hot water and bleach. C. He should remove the scrub top by using scissors to cut it off and discard it in a biohazard labeled container. D. He should remove the scrub top by using scissors to cut it off and discard it in the trash. So pause there if you like. And then next slide, I'll have the answer. And the correct answer is C. Removing the scrub top by using scissors to cut it off and discarding it in the biohazard labeled container is the best option for him to follow when there is a contaminated large blood spill. And finally, this brings to our last topic, which is construction and renovation. So FGI, or Facilities Guideline Institute, provides guidelines and recommendations on constructions and renovation activities. And it uses ICRA, or Infection Control Risk Assessment, as a mandatory part of planning, designing, and constructing processes, as well as addressing construction design elements related to IPAC and identify potential infection risk posed by the construction work. One of the potential risks related to construction and renovation work is Aspergillus. Aspergillus is a mold or a type of fungus, and Aspergillus fumigatus species is the most common cause of aspergillosis infection. They are found in the soil, water, decaying vegetation, and building materials. Most people breathe in Aspergillus spores every day without getting sick. However, people with weakened immune system or lung diseases are at a higher risk of developing allergic reactions, lung infections, and infections in other organs. Among the transplant patients, the mortality rate has been reported to be between 25 to 59%. Hospital-acquired infections may be sporadic or may be associated with dust exposure during building renovation and construction activities. It is also not reportable and not contagious, which means no precaution is required. The ICRA, or the Infection Control Risk Assessment, should be completed by a team that includes representatives from infection prevention, safety, engineering, and healthcare providers representing areas within the facility that are likely to be affected by the construction. The infection preventionist role on the ICRA team is to assess the needs and the risk of the residents, staff, visitor population that will be affected by the construction work and address the infection prevention needs of the residents and healthcare providers that will occupy the space after construction, and also provide evidence-based guidance on IPAC to the project design team. So this is one of the templates to complete the ICRA from ASHE, American Society for Healthcare Engineering. These steps will help you guide to determine the risk mitigation strategies during any type of construction and renovation work. You don't need to know this chart by heart, and neither were these tables in the LTC CIP EPIC learning systems. I just wanted to share with all of you what the 5 steps were to take during the ICRA process to determine the risk mitigation strategies. So here in step 1, it is to identify the activity type. And there are 4 types, type A, B, C, and D. And depending on what type of work your construction involves, you will look for that activity and align it with that type. So for example, here you have type A and B, and in the next slide you have type C and D. And let's say your work involved installing a drywall partition. The activity type that activity falls under is type B, which I've underlined here. So in this case, it would be type B that this work would fall under. So let's say you have a variety of work, right, in one big project, and you have activities under type A, and then you have a different activity under type B. Then your activity type will be based on the higher activity type. So it would be the higher activity type, okay? So this is step 2, and this is where you need to identify where the work is taking place. So let's say in our case, we are doing our work in the patient care room or area, then our patient risk group would fall under under that particular risk category, which is high risk, which I've underlined here as well. So here in step 3, we will then match our findings in step 1 and 2. And step 1 was our activity or project type, which was type B. And step 2, our patient risk group was high risk. So when you align type D and the high risk group, you get to the Roman number 5 as the class of precaution, right? And in step 4, what we do is we assess the other potential risk surrounding the project, which is noise, dust, vibration, ventilation, any pressurization issues, and any issues with the elevators. And then in the final step, which is step 5, which is the class of precaution list, they list the mitigation activities. So in our case, because our activity was classified as class 5 precaution, we would then check off that box and ensure that whatever risk mitigation activities listed in type 5 is mentioned, we have to make sure that we follow that we comply by all those interventions that's mentioned there. Okay, and that is part of the ICRA process. So because the ICRA involves multiple departments and outside contractors, it is prudent to establish a policy for ICRA. And the policy should specify each departmental responsibilities for each of the aspects of the ICRA, the type of work that falls under the ICRA requirements, the definition of the terms that are used in the ICRA, so everybody has a clear understanding of what the terms mean, procedures for validating compliance with the ICRA, and any record-keeping requirements related to the ICRA. These are very important to include in the ICRA policy. So here are some considerations to make during the ICRA process. So the American Society of Healthcare Engineering, or ASHE, ASHE, their standards, as well as the facilities guidelines, institute guidelines, provides directions for pressure relationships, ventilation rates, and other air quality factors, and therefore ensuring that the proper pressure balances and ventilation rates can be achieved is very critical. The FGI guidelines also establish the minimum number, types, and location of hand washing stations. Hand washing station design should consider materials and installation of to ensure ease and effectiveness of cleaning and disinfection, as well as water pressure regulation, faucet placement, and sink design to control splashing. Sink counters made from porcelain, stainless steel, or solid surface materials are good choices as they can withstand water damages. Hot air dryers are permitted under the FGI guidelines, but paper towels are still superior to hand dryers in removing bacteria and minimizing contamination. As for plumbing, during renovation projects, the water quality management team may request routine flowing of water lines that are not used regularly in order to ensure that chlorine or other disinfectants that have a good effect in controlling bacterial and biofilm growth, it reaches those areas. And for carpets, carpet is not appropriate in areas like laboratory, environmental services, or food services, nutrition areas, where spills and soilings are likely. Nor is it appropriate in any location where exposure to blood or bodily fluids is likely, which would be all patient care areas. The only areas where carpet may be acceptable is for lobbies and other high traffic locations because of its ability to trap dust and reduce sound. So here are some of the risk mitigation strategies before and during construction or renovation work. The barrier system or containment, which is pictured here, can be created to contain dust generated during construction along with any potential infectious microorganisms. They may be constructed of flame retardant plastic sheeting, rigid plastic panels, or drywall board is also sufficient. Creating a negative pressure within the contained work zone relative to the adjacent spaces helps to prevent the release of airborne infectious agent in event of a breach in the containment barrier or when opening doors to move workers and equipments in and out of the work area as well. This negative pressure is created by exhausting the air from the contained workspace to the outside atmosphere. Using HEPA filtered vacuum filters or units are excellent at controlling dust. These units have pre-filters that also collects larger dust particles. So these pre-filters need to be checked on a regular basis and be changed as necessary. Each facilities can be proactive and provide training or orientation for their contractors that outlines the ICRA process and reinforce the risk mitigation strategies. Highlighting certain practices during major construction work, such as creating dedicated traffic route, using wet mats or tacky mats or sticky mats, and shoe covers are all steps that can be taken to control dust and prevent contamination. Last few words. It is not the infection preventionist's job to tell a contractor how to do their work. Telling the contractor how to do their work may just result in problems with project schedules, cost, and liabilities. The IP's job is to verify that the work is conducted in a manner that adequately controls the risk of potential infections and that involved parties comply with the risk mitigation strategies. The IP should work with and through the facilities project manager. Conducting periodic rounds of the construction sites with the ICRA team members is a good way to validate compliance with the recommendations and to ensure that any problems identified are corrected. I think this is my last few questions. Question 6. Poor planning during construction project can lead to an increased risk of infection related to 1, construction delays, 2, compromised air quality, 3, contaminated water, 4, increase in construction related traffic. So option A, you have 1 and 3. Option B, you have 2 and 4. Option C, you have 2 and 3. Option D, you have 1 and 4. So you have to choose between option A to D, okay? This might be a little question within the question, so yeah. Take your time, pause here if you'd like to compare your answer with the correct answer in the next slide. Okay, so the answer is C, which is 2 and 3, and that's compromised air quality and contaminated water can lead to a potential risk, infection control risk when you're planning a construction project. The other two does not really increase our risk. It may just, you know, be an issue with scheduling and other related tasks. The last question we have here is question 7. The ICRA should include all of the following elements related to building design features, except A, location of special HVAC serving areas, B, water systems to limit waterborne pathogens, C, air handling and ventilation for airborne infection isolation, or D, sewage system to allow adequate sanitation of waste. Okay, so pause here, and then the answer is D, sewage system to allow adequate sanitation of waste. Yes, this does not include in the ICRA when it comes to building design features. Okay. So here are the references that I've used for my presentation today. And if you'd like to look that up, you can. And just last few words, I just wanted to thank you all, first of all, to listening to my presentation. I know it was pretty lengthy. I just wanted to also wish you all the best. I think it's totally normal to feel stressed, worried, and anxious about any exam. And I feel like we could totally use positive affirmations to, reduce our stress, and also ward off that negative thought, right? So I think it really helped me in my career when I'm using these positive affirmations. So statements like, I'm confident, worthy, I know this material, and yes, I can, I'm calm and focused, and I'm determined, my hard work powers my success. I think that has greatly helped me change my negative, pattern thoughts into positive, and I hope it may also help you. So all the best, and I know you can do it. Thank you. Thank you, James.
Great, Dechen. So I just want to say I love that you're finishing with these positive affirmations, because part of our intention of putting this lecture series together is to empower all of our IPs that are working in long-term care, protecting the residents, to be successful in writing their LTC CIP. And I think that anybody who spent the last hour paying attention to you is going to be one step closer to being able to achieve that goal. So when I started in infection control, I thought it was going to be all about patients, and I never considered how the environment could impact the safety. So one of the things that I really loved about your lecture was that you brought it back to the chain of infection, and um, and everything that we do in IPAC can do that, about you brought back air. And so the HVAC system and the chain of infection, and how does having a proper HEPA filter or MERV protect you from small microns. You talked about the water, and consider in your long-term care home, do you have a fountain or a decorative water ornament, and is that the right temperature to grow Legionella that could potentially make my residents sick? And then finally, about the construction. I can get a little bit nervous thinking about the construction, but the way you described it, it's like it's not our job to tell them how to do it, but to make sure that it's being done in a safe way. And I really loved the way that you described all of these items. So thank you so much, Dechen. This was the environment of care. This is going to help you prepare for your LTC CIP. All right. Thank you, everybody.
Thank you.